Can we just have that one more time? I mean, that was fun.
What, Kegel rhymes with bagel?
Oh, yeah.
Nice.
That should be the name of this podcast. Or Swiss cheese. Or you got showers and growers. I don't know. The possibilities are endless.
For education, why you waiting? Time to get it. Change your mindset about nutrition and fitness.
Hey, what's up, everybody? This is Ryan Waters here with Shred KC, coming back at you after a long stint of nothing. Sorry about that, but the COVID shut us down for a while.
I did a count. You're over 100 days.
100 days?
100 days since our last episode.
Man.
We back.
Sorry for slacking, y'all. I'm here today with Amanda Fisher. She's the owner of Empowering Your Pelvis. This is Amanda Fisher, Empower Your Pelvis Take 2, because Slick Nick, he had his computer crash and lost our first one. So we're bringing Amanda back with her busy schedule. She's taking some time to come back here and tell you guys about the pelvis, men, women, pelvic health. She's an expert in the field. So check her out. Her Instagram is empower.your.pelvis, correct?
Got it.
Yep. Check it out. She puts out some good information. So tell us a little bit about yourself, Amanda.
Yeah. So I'm a physical therapist. I have a wife, have 3 children, did my doctorate at Rockhurst University, and while I was in school there, developed my own pelvic floor dysfunction. So I was running a lot at the time, doing triathlons, and started peeing my pants, and just thought that was really odd because that's not how muscles are supposed to work. Mm-hmm. And went in further, dove in deep, and found that the healing process through stopping to pee your pants and dealing with pelvic pain, which I was also dealing with, was through physical therapy. So I switched over from orthopedic, sports med into the pelvic floor world. And at the time was very slim, nobody in it. Ended up doing clinicals out here in Lee Summit and across the United States, and decided to stay here and joined a practice locally in Lee Summit and started their pelvic floor program back in 2011, and jumped out and started trying to educate the community here about pelvic floor dysfunction and peeing your pants and how it's not normal, but it's common. And Lee Summit wasn't ready for that in 2011. But things have changed with 2020.
Is anybody ready for that?
Yeah, right. No, if you check out her Instagram, she puts out some good content, and it's uncensored. It's great stuff, and if you're easily offended, then stop being easily offended.
I did that though back in 2011 when Facebook was around and Instagram wasn't yet, and good God, I got a lot of tough messages on that. And then when Instagram popped in, 3 years ago, I probably started Empower Your Pelvis on Instagram, and it's doing well. I don't delete my posts nearly as much as I used to.
I think what people should remember is they're looking at your stuff, and if you don't have anything nice to say, don't say anything at all.
Yeah.
I have to delete a lot of comments of people just chiming in that have no idea what they're talking about on our post, and it's like, why even say anything like that? It's very frustrating, but that's the world we live in. Okay.
Even my mom is very Amanda, wow, you're very open with your life. Mom, maybe just scroll past that.
Yeah, right. Yep.
No
TMI with you.
No
TMI. You had a little live the other day. Ask questions. You're like, ask me anything. There's no TMI or whatever.
Never TMI, because people, if they don't tell us the whole story, then we can't figure out really what's going on with
I'm sure
them.
A lot of people are kind of embarrassed to tell you the whole story too.
Absolutely.
To come in and say, yeah, I'm peeing my pants or pooping my pants or whatever.
Yeah. Because I've been there and I know how that feels, and it's very uncomfortable.
Yeah. So explain to us the pelvic floor. What is it and where's it located? And give us a little bit of background.
Yeah. The pelvic floor is an umbrella term for a group of muscles at the base of the pelvis. So they run from the front of the pubic bone. She's got a pelvis here. Front of the pubic bone, back around to the tailbone and sacral area, and then out to the hip joints as well. There's a nice external rotator down in the pelvis, which is part of the pelvic floor, but approximately around 30 different muscles down there. So people typically hear pelvic floor and they just think one big muscle, and that's not the case at all. So lots of room for compensation and error. You have a front side, back side, left and right, and some of us typically might end up with weakness or tension on one side, just like we do anywhere in our body. Mm-hmm. So it's learning how to get it to balance, but move through different movements with our legs and our torso so that it can work properly.
Okay. So how does it function? Does it make everything down there work? The muscles down the pelvic floor, like, when you number 1 and number 2 and sexual function and everything?
Pee, poop, and sex.
Yeah.
They should move up and down like a regular muscle and be able to contract and relax completely. So they are a concentric and eccentric motions. They should hold back your goodies so nothing falls out. So supporting our organs, not letting gas pass or urine pass when you don't want it to. But then when you need it to, allowing for that function to happen. They aid in orgasm and ejaculation. So you need that range of motion to make that happen. If they're lacking in range of motion or having decreased range of motion, and I'm using my arm for the camera, if you think of contracting your biceps all the way up, those muscles can be tight down there. And if that's the case, then they typically are more hypersensitive. So it may be uncomfortable with penetration, or for some women, like inserting a tampon or a Diva cup, menstrual cup. But any kind of touch down there, even with their pap smears, might be uncomfortable. So learning to let that go. Or for males, it might be pain with arousal, pain with ejaculation, maybe in the scrotum, tip of the penis. It can vary. The cool thing is, like, everyone has a pelvic floor. It's always with you. It's the same stuff, male versus female. It's just, things are located a little differently. The clitoris is the penis. The scrotum is more of the labial tissue, but they all function pretty much the same way.
Okay. So if you're in a public place and you're holding in a fart, that's your pelvic floor working to hold that in.
Yes, absolutely. And if things are slipping out, then something's not working right.
Right. Yeah, things slip out sometimes, especially by doing sit-ups. People fart a lot doing sit-ups.
Well, that's a lot of pressure getting pushed down in that area. So I totally get that. But if it's... Or if you got weights like sitting on yourself and you're trying to, what is that, the bridging? That's a possibility too, because something's pushing in as you're lifting up.
Yep.
So
Accidents happen.
It does.
That's why that's what Amanda's here for. Have a strong pelvic floor for you, so you don't fart in public. Okay, so what are your most common cases when people come in to see you, like with this dysfunction? What's the most common thing you see?
Most common would be urinary leakage, so peeing your pants, pelvic organ prolapse, so bladder prolapse, uterine prolapse, rectal prolapse, pain with sex, and the prolapse tends to be more of our female population, but males still do have rectal prolapse without the vaginal opening.
What's that?
So prolapse, we have 3 openings as females. So the pelvic floor muscles hold up all sides of around the pelvis. So you've got the muscles holding up the bladder, you've got them holding up the rectum, and then you have your uterus up top. So if those muscles are strained, so if somebody's lifting heavy or straining to have a bowel movement or straining to really do anything, those muscles will start to get stretched in. And then that's not a strong muscle that's holding things in place. So we will see these organs push against the musculature wall, and then you'll see that pop into the vaginal opening. So maybe someone who's coming in with a bladder prolapse, you may see their bladder, like the muscles, the bladder pushing in on the muscles in the vaginal opening, or the rectum. With rectocele, they may even splint to have a bowel movement, so they maybe even have to insert fingers vaginally to be able to push stool out, or uterine prolapse with a lot of women who have had childbirth. So with having children, whether it's a cesarean delivery or vaginal birth, you are putting yourself at 50% risk of having a prolapse. Now, great thing is, if it's truly just musculature, we haven't messed with the ligaments too much, it can improve with pelvic floor physical therapy. We've seen a lot of patients come in and then decrease symptoms of feeling of pressure or pain, feeling like a used tampon kind of sitting in there. We've improved their symptoms so they can avoid surgery, but surgery might be an option for them. Or they have these awesome little things called a pessary, and it's like a sports bra for your vagina. It inserts up into the vaginal canal, lifts the walls apart, so it helps to support and hold the organs in place. And sometimes a lot of my patients will end up doing that. We used to think it was just for women in their 80s, and now I'm having a lot more women in their 20s, 30s, and 40s who maybe want to stay active, stay at the gym, continue to run, or who live on a farm and are lifting a lot, that they can just insert that pessary in for the day, avoid their symptoms, avoid making it worse, and then take it out when they're done with their activity. So it's a great tool to have as we're working on strength and endurance and coordination in their pelvis.
Interesting. Okay,
and then pain with intercourse, diastasis recti, prenatal, postpartum.
Okay.
Would be our
so is your clientele mainly female, or is it?
No, it's like 35% male.
Really?
I'd like to see that grow. Because there's a lot of men that are living in silence right now.
Yeah. Well, I thought it was interesting when I don't know how I first came upon your Instagram or how we met, but it was interesting some of the stuff you put out, because being a trainer, I have had women that, you do jumping jacks. Jumping jacks seem to be the worst. Is it because they're taking their legs wide and narrow and they're jumping at the same time, or why? I mean, it's
a complex movement.
Yeah.
So what I tend to find is that our women who are doing jumping jacks really try to keep their shoulders up and back. And when they jump, they tend to arch back a little bit. So when they're doing that, they're lengthening their abdomen and they're usually tilting their pelvis. So that connection in between our ribs and our pelvis, we like to keep them stacked so they can move through. I like to say your pelvis should move like a trampoline, your pelvic floor muscles when you're exercising. But when you get into that position with any like jumping activities, jumping rope, women who tend to get into that type of posture will lose that connection, and then it's not firing correctly. So then you don't have the sphincters around the urethra firing well, and then women pee their pants. So sometimes it's as easy as just fixing their posture with that activity, and then things activate the way that they should. Other times you realize when they come in for an evaluation that maybe their strength isn't there, and they should hold off on that activity for a little bit to build up the strength and endurance. But you're changing the posture in the torso, and then changing lengthening the muscles as the legs go out.
Yeah, I've seen a lot of women run off into the bathroom doing jumping jacks. It's weird. I never knew why. I would assume it because they had kids and stretch things out, but I didn't really know. I didn't know.
And actually, that's another misconception too. Like a lot of our patients haven't had children. So we see the incontinence kicking in a lot with our high school athletes, our college athletes, a lot of our young 20s, that the pelvic floor, what we're finding with our athletes is it's a little bit more hypertonic. So it's that decreased range of motion that maybe they're exercising so much and not learning to let it back down, let go, relax the tissue like you would your arms. Like you could see someone at the gym walking around with T-Rex arms and be like, hey, dude, put your arms down, relax your arms out. But the pelvic floor, since it's inside the pelvis and nobody can see it unless they're aware on what it feels like, a lot of our athletes are used to tension holding. So it's training them to let it go and then build that muscle back up through that full range.
Muscle, you have overactive muscles and underactive muscles, and muscles that compensate for those.
We're just the personal trainer for these guys.
So do you help fix, I see this a lot, it's a really common muscle imbalance is the anterior pelvic tilt.
Yeah.
So do you help fix that?
And that's a lot in our pregnant population.
Because all the weight's in front, arches their lower back. And, the big problem with the anterior pelvic tilt is that's when your pelvis shifts forward. So the back of your pelvis goes up, the front of it goes down. So it's that downward angle in front. But your hip flexors get really tight. So you're in the backside, your glutes get stretched out. So a lot of women have, I call it saggy mom butt. Yeah. So you get saggy because you're not activating those muscles.
Right.
They're underactive because they are lengthened too much. And then they have a lot of problems filling squats and everything more in their quads because their quads are tight. Yeah. So you got to loosen the quads, stretch out the hip flexors, strengthen the glutes, strengthen the hamstrings, and that I think that's one of the most common lower back pain injuries is the anterior pelvic tilt. Like if you look at somebody and you got that arch in the lower back, and another problem is underactive lower abs.
Yes.
So the same thing that's going on in the backside where you're not getting your glutes activated enough. The same thing's going on in the front with your lower abs. So, when I cue people to do planks, I always have you, especially if you have anterior pelvic tilt, activate those glutes first to shift your pelvis back in place. And then you can shorten your abs and get more activation in that. So I didn't know how much of that you saw.
We actually see a ton of that as well because our pregnant population, they're stretched for 9 months, 18 months, 27 months. So your external obliques will tend to get a little tight.
Yep.
They start to fire a lot more, especially with those upper abs. And so the women end up coming in compensating for a really long time. So you're having to retrain that tissue to fire correctly, recoordinate how they're doing, like a hollow hold. That's always, I want to work towards that. But we've got to break it down and really work on the coordination at a smaller level and teach them to fire those internal obliques and the lower abs again. And if their pelvic floor, let's say they had a vaginal tear, so, a grade 3 tear, that's like a rotator cuff injury, they're going to have to work through that tissue's now healing. It's probably healed tight because most women aren't stretching their pelvic floor like you would go in and have your arm stretched or your leg stretched after a surgery.
Yep.
So that tissue's fired up tight. So if they're tight, then the lower abs aren't going to fire on properly, and we're going to over recruit with the uppers.
Yep.
So we have to kind of even backpedal down to the pelvis and learn how to lengthen that tissue and get it to fire in with the core again, as we're retraining and recoordinating that for them. And a lot of them come in like, I didn't expect this to be so challenging, but it's more mentally with the
Just
reconnection.
like I preach all the time in the gym, you got to put your mind in your muscle. You have to know what muscles you're activating.
Right.
And once people figure that out, they get a lot more out of their workouts. Just like anything, you got to know how to work the muscle and not just go through the motions.
Right.
So like you said, you got to train the muscles.
And it's outside of the gym too, because we're seeing, like, then they'll come in with, maybe it's their bag, or if it is a mom, it's with the car seat. Like, it's awful lifting skills, and retraining, like, okay, that's your kettlebell that you've been lifting for the last hour. Like, now you got to think about that all throughout your day for the next 24 hours so you can keep things working well.
Yeah, people have a misconception that just doing like sit-ups will help you strengthen your core, but you know, your rectus abdominis controls spinal flexion.
Right.
So if you just do sit-ups all the time, then you're going to end up rounding your spine forward. You see that all the time. And then also people do sit-ups and they move at their hips more, you know, so they're not even really activating their core. They're just sitting all the way up, and that their hip flexors are what's pulling them up, and that's making their hip flexors even tighter. So like planks, hollow holds, I mean, even like leg lifts, if you do hanging leg raises, which you would think would target the lower abs, you're using most hip flexors and quads to get your legs up. So those aren't good exercises if you're having, you know, if you have an anterior pelvic tilt, if you have tight hip flexors. One thing too that I found that acute people to get the hip flexor stretched out is when you're on one knee and you have one leg back and you're stretching that. People, what's that stretch called?
Hip flexor stretch?
Yeah, something like that. Yeah, whatever. And so you know, they try to just lean forward instead of activating their glute. So I always cue people to activate their backside glute or the hip flexor they're trying to stretch, and it shifts your pelvis, and then you feel that hip flexor stretch so much more. You don't want to just like lean into it as far as you can until you feel it. It's just that simple motion of activating your glute to shift that pelvis back down. So, okay, so talk to us. We had one of the most popular podcasts we had was form and technique and putting your mind in your muscles. So I sat here and described exercises and gave people cues. So like sit here and talk to us about how we would activate our pelvic floor. We tried this last time on take one.
Okay.
And I remember,
I don't remember this.
Well, yeah, and I was flexing my glutes instead of my. Oh,
that's right. You were lifting up.
But now I got it. I'm flexing it right now.
Okay.
Yeah, I'm holding.
Can't even tell.
You can't even tell. No, it's effortless.
Right.
So walk us through this.
So what I like to tell people, sit up in a hard stool or hard chair. So you're going to sit on those sits bones. And for your females, you're going to think about picking up a blueberry with your vagina, or sucking a smoothie through a straw down there.
A Shredlicious smoothie if you want to go get one of those. Okay,
Made with love, not sugar.
That's right.
So you're going to pick up that blueberry, and then you're going to put it back down. And people ask, why that way, not a Kegel or thinking of stopping the flow of urine? Rarely does someone come in, and I'll cue every single person first and foremost when we do an internal muscle examination, like try to stop the flow of urine, and they forget to use the muscles that actually close off the hold. So typically most people are forgetting to use the anterior portion or the front portion of the pelvic floor. So when you can cue them on something like picking up a blueberry or sucking a smoothie through a straw, it mimics what the mouth does, because those muscles are the same cells. They're just split in utero. So it'll help to engage all forms of the pelvis to cue that. And then you think of putting it all the way back down, because we don't want to contract muscle. We want it to relax before we pick it back up. And very few people can actually lengthen it and let it go all the way back down in that eccentric control. It either drops, or it's like being on an elevator with my kids and they've hit every single button, and it's really not smooth.
Just like we talk about in the gym, you get the most out of being able to control your muscles on the eccentric.
Yes.
You know, like anybody can contract your muscles to move weight or flex your pelvic floor, but unless you can keep that control as you relax, you know, like just don't flex and relax.
Yep.
Yeah, because you're not getting that eccentric motion with that.
Yep.
So I texted you about this yesterday, about the energy centers, the chakras.
Yeah.
And I'm going to touch on it a little bit because I'm not going to act like I'm an expert on it because I'm a novice to it, but I started getting into meditation, and your root chakra is right there, your pelvic floor, basically. It's at the bottom of your spine. And so the way that you cued to activate your pelvic floor is the same that they cue you when you're meditating and try to activate your root chakra. So I was doing that, and it finally hit me because we did go over this last time and I couldn't get it. And then I was doing a meditation the other day and I activated. I was like, oh shit, I got it. And then I knew you were coming back on, but it's like what, your perineal or
Yep,
is that
perineum.
yeah. So, if you guys know anything about energy, they're energy chakras, or they're, you got 7 in your body, I believe,
Yeah.
and they're tied to different emotions and different things that you're dealing with in life. So, like if you have a overactive root chakra, you could be like, you could, like, it's for safety and security, survival, basic needs kind of thing. So it's just interesting learning some of that stuff. I was checking it out before we came, but
and we hold a lot of our emotions down
Yes,
there.
yeah.
We've done a lot. There's been a lot of research on putting electrical activity things on the muscles to figure out which muscles fire the most when we watch the news and it's negative, or we're triggered by some stress level, anxiety, and the pelvic floor are the first muscles to fire with that. So it's teaching people to recognize, like, maybe you don't think you're stressed or anxious, and it's not like it's a subconscious thing. It's not that we are consciously doing it. It just kind of happens. But when you can feel that contraction, like learning to let it go, or knowing, like, I'm in a stressful environment, like, how can I let it go?
Relax,
And maybe
yeah.
breath. The breath
breathing is huge.
It's free. It's always with you. You can use it wherever you go. People try to get really complicated with exercises on this, but the breath is the biggest thing. You feel something, take in a couple deep breaths, calm that parasympathetic nervous system down, and lengthen the tissue, because it's the one thing that can actually get into that pelvic floor and change the length in that tissue. If we're stressed and anxious too, we tend to breathe more upper chested, and if we're breathing up, we're using more accessory muscles in our neck and not letting that breath truly go down into that pelvis. So it's very important to just focus, take a little time out, and even if it's 5 breaths, it really can do some good.
Yeah, breathing deep breaths in your nose and out your mouth and relaxing. That's best medicine.
Relax the jaw.
That is the best. Just relaxing your entire body and
Yeah.
being aware of your body.
Yep.
So I'm reading or listening. I don't really read. I listened to this audiobook. Dr. Joe Dispenza. Have you heard of him?
I've heard of him.
Yeah. He's a chiropractor and got into meditation and self-healing and everything. And the book is called Becoming Supernatural. And he has big group meditations and everything. And they hook up, electromagnetic field things to bodies, whatever they call them,
EMG.
Yeah, something like that. Yeah. And actually, they call them HIV, because when he was saying, I was like, you hook up HIV to people, but whatever HIV stands for in those terms, that's
Okay.
what they hook up. But it's talking about people, like, when you're aware of your body and you can tune into that, how people self-heal. Like, and there's, how disorders that they've been on medicine, depression and everything, that you can self-heal without medicine. And a lot of people...
You can focus your mind and
Yes.
brain on that area to really bring the blood flow in and help with that tissue healing.
Yeah.
And
Yeah.
then it's huge in pleasure too. So, like, thinking like the pain with intercourse side of things, because your body reacts to pain and dysfunction. So if people are dealing with pain with intercourse, male or female, well, then your body gets used to, oh my gosh, every time it contracts this way, we got to put our guard on, we got to protect, so we're going to tighten even more. And learning to recognize those feelings and using your mind in that moment of, like, okay, I need to calm it back down. How do I release that? Help get the pleasure side of things there in that moment. So it is a lot in your mind, but also in the tissue.
Yeah. So if I'm sitting here flexing my pelvic floor, like, my penis moves a little bit. Like,
Yeah.
is that supposed to do that? Like,
And your scrotum may
yeah,
lift up too and
yeah.
get a little tight.
So I'm doing that right now as we're sitting on this hard stool. So let's talk about men's pelvic floor dysfunction. What's that look like? I know we talked last time about, like, if you have erection, like if you have a weak pelvic floor, it's like 3 o'clock, 4 o'clock, 5 o'clock, but you want it to be like 2 o'clock, 1 o'clock kind of.
Yeah.
Yeah. So how do you strengthen that? How do men get that? Like, tell me a little bit about the male dysfunction.
So it's very similar to a female because it's muscle tissue. It's tissue itself. So if things are dysfunctioned, what we typically find, especially with our males, is like all the tissue needs are space, movement, and blood flow. So if you can figure out how to give that tissue, whether it's nerves, whether it's muscles, the space, movement, and blood flow, then it will start to heal and actually respond how it's supposed to. So if we're dealing with muscle tension, where maybe the muscles can't lengthen and contract the way that we need them to for an orgasm or an erection, that if we can start putting them through movements or the breathing, they can lengthen that stuff out. And then once we can get the length and the range of motion, we can start to build up the strength and endurance in that tissue. So it's progressing them through. Maybe we start with the breathing. Maybe we start with some gentle mobilizations to the tissue. Maybe it's moving through some gentle stretching, yoga positions like child's pose. I love child's pose. Happy baby, deep squat.
No, happy baby.
You know Happy Baby?
Yeah, I know Happy Baby.
It's a good one.
Yeah.
The pelvic floor doesn't relax as much in that one as much as the child's pose. Oh my God, I'm talking with my hands. Sorry. Yeah. But they're really great to help open up that tissue. And then nerve glides. I think a lot of pelvic PTs will miss reminding themselves that the nerves that supply this area also run all the way down to the foot. So if they're hypersensitive, like we should definitely be doing nerve glides. And if we can tell that if we do a nerve glide and someone flexes their foot and they feel that in their scrotum, then okay, we should probably continue to do nerve glides to help improve that nervous system and decrease that sensitivity for those people. So male pelvic pain, incontinence, we do have men that, or urgency and frequency. We've seen that in our males. The incontinence typically comes in either with a high tone pelvic floor or post-prostatectomy surgery. So those are our older gentlemen. But our men that have really intense, stressful jobs tend to be more of our hypertonic, high tone pelvic floors that turn into pelvic pain or pain with or issues with erection.
So tell me why it's so hard to pee after you have an orgasm. Like you feel like you have to, but...
Yeah, so your muscle tissue, men, the penis is like... I hate to. It's like Swiss cheese. I'm
not sure.
I've never thought about my penis like Swiss cheese.
I don't know if I like that one.
So when it's not hard, it's you've got space for it to grow with extra fluid. So the holes in the Swiss cheese are
grower, not a shower.
Sure.
You got growers and you got showers.
The space is going to fill up with extra blood flow. So when the sensory systems for you guys kick on, depending on what caused the erection, that they're going to send blood flow there and help to increase the size of the tissue. So that's where the Swiss cheese will fill up with blood, right? Yep. Or fluid. And I forget what the question was now. But that's right. Pee, yeah. So after you ejaculate or whatever, you guys, it's still full of all that extra blood flow. It hasn't circulated out yet. So that's why it takes time to urinate, whether you're a female or a male. Like when that tissue is aroused around that area, it's expanded, it's swollen, and it has to get back down. So for a lot of if we're having issues with that, like some of my females will have pelvic pressure or pelvic pain after, and so we'll have them go lay down and do some breathing to really help circulate that fluid through, because as you breathe down, again, that pelvic floor is going to lengthen. You breathe out, it's going to come back up like a trampoline, and we want it to circulate the blood flow and fluid out of there.
Okay. Interesting.
So you can pee again.
I can pee again. Yeah, you sit there for a long time. You're like, I almost fall asleep.
But Swiss cheese. Remember
Swiss cheese. Yeah, showers and growers. Well, that's another podcast topic. What's that?
I don't know about that one.
You don't know about that one? Okay, so I'll explain it to you. Some guys are showers, so they're like when they're hanging dong, they're like they're showers. It looks bigger, but when they get erections, it doesn't grow that much more. And then some guys are growers. So you got showers
like baby
and
Swiss cheese versus regular Swiss cheese.
That's right. You got showers and you got growers. All right, so I was checking out a YouTube on prostate health to get some questions before I came, and this physical therapist, she specializes the same thing that you do. I think she's in another state, obviously, but she was getting questioned, and she was the lady asked her about milking the prostate for men, and she said she doesn't normally do that, but she takes appointments for spouses to come in, and she will teach
them how.
Yeah. Yep. Is that something that you've ever done? That seems very...
I don't do that, the stimulation therapy. Yeah, we don't do that in the clinic, but yes, any partner is allowed to come in, and we do train them in different techniques that we would do with our clients.
Interesting. I'm not into that, so I just thought I'd ask if you did it. It seemed a little weird. Okay.
Because there's a lot of times, like if we're, so our patients just aren't all around Kansas City. Like we have people that travel from out of state, Arkansas, way out in Kansas, Columbia. So they've got quite a drive. So I may not see them every week. So if we can have them work on things at home, and maybe that's something that they need to work on, then yeah, absolutely. I want their spouse or partner to come in so they can learn how to do the techniques at home. They come back in, we reassess, where can we progress on?
Okay.
Yeah.
So
It's not uncommon.
Talk a little bit about your feelings on Kegels, Kegels. How do you say it?
Kegel rhymes with bagel. It depends where you are in
Put some Swiss cheese on that bagel.
Can we just have that one more time? I mean, that was fun.
what? Kegel rhymes with bagel?
Oh, yeah. That should be the name of this podcast. or Swiss cheese. Or you got showers and growers. I don't know. The possibilities are endless. Okay.
Okay. Question again.
Kegels,
sorry.
yeah.
Oh, yes.
Yeah.
So just what is it?
Well, is it beneficial?
Oh, yeah. This goes back to the whole blueberry thing of, yes.
Is it to tighten? A lot of women think it's to tighten their vagina.
That's where I think the misconception is, because a lot of people are actually more tight in areas than they need to be. So like I will explain the pelvic floor to my patients that the front of your pelvis, this is just like, I don't know, my week this week. A lot of my pelvic floor patients had the front part of their pelvic floor, their anterior wall was like on vacation, and then their backside was like overworking. So like type A personalities. So if they were to do Kegels, most people will feel more of the sensation back at their rectum anal area because we have more sensories there, sensory nervous system. So if they're sitting up nice and tall and you do a Kegel or try to pick up blueberries, you're going to feel it more at the rectum, right? So for them, that's not going to be a good thing to do. So it's teaching them how to do Kegels or blueberries or picking up a smoothie down there in different positions. So like you guys here, if you guys lean forward on your forearms onto the table and try to do the blueberry, you're probably going to feel it more forward in your pelvic floor. Like women will typically feel it more at the urethra or clitoral area. Men more in that anterior portion of the pelvic floor too. So it's different ways, different positions to get that to fire. And I would do the same thing like if we needed that front part to fire and they were leaking with jumping jacks or jumping rope or running, we may completely tip them forward to get that front part of the pelvic floor to fire and start doing activities there to get the muscle facilitation and then move them back into that normal posture position.
Interesting. Yeah, it probably just goes back to muscle activation. Like you don't need to put balls up there if you know how to contract the muscles and have the eccentric motion. But
yeah, you've got to get it moving through the full range, or the Kegels are just going to make your symptoms completely worse.
Interesting. Okay, let's switch topics. Unless you got anything else that you want to.
I don't think so.
No,
Nope.
Nothing else.
Nope.
Okay, so well, let's go over some exercises. Like if you're going to prescribe somebody ways to strengthen their pelvic floor. Is it just like activating it and relaxing it? Like stretching?
That's probably like day one.
Yeah.
Day one, day two. But I like to get people moving through, it really depends what they're doing. I like them to learn how to do their concentric stuff, but then we've got to get in eccentric and we've got to get in hip mobility. Most people are lacking like hip internal rotation. So we're going to be working through range of motion in the hips, and then we'll get you into functional exercises with rotation and the pelvic floor. And then we may do some, like I love the Rogue box. I love working with that on our prolapse patients and our pelvic pain patients because it's a good eccentric load as they're coming down. So we can do like a single leg. We can do rotations off of the box. We can turn around and do some pistol squats with it. Like there's a lot more to the system than just laying on your back and doing Kegels all day. That's really very few of our patients.
Yep. And I know I've heard a lot of women talk about how sex is more painful around their menstrual cycle, before they have their period. Why is that?
I would say it varies person to person. But the tissue can start to be a little bit more sensitive. Your muscles respond to the organs. So if your organ's starting to shed a layer of its tissue, the muscles will start to cramp and contract for that. If you're having issues with your bowels, the muscles will contract for that. So that may be where they're having more of that hypersensitivity. And also with their menstrual cycle, oh my goodness, ovulation. The cervix is going to drop down. It moves throughout a female's menstrual cycle. So during ovulation, it's going to come down lower. So if they're having deeper penetration, they're probably hitting their cervix, because women will complain like, oh my gosh, it hurts so bad. They feel like they're hitting a wall when they're intimate with their partner around that time. And it's usually because the cervix has dropped. So getting out of that ovulation period, I mean, our bodies are smart. It's trying to create a baby at that time. So that's why it's dropping down. But as it moves up, then typically like the same positions that they would feel that, and they wouldn't feel like they're hitting that wall.
Another thing is you give, like, and you said your handouts, you give away lube. What's your suggestion for lube?
So I'm big on safer things for the body. Our female bodies, our vagina is mucosa. It absorbs everything. It secretes it and takes it into the body. The vagina is just like the mouth. So the lips of your mouth aren't very absorption, just like the lower end of the vaginal canal. So as you put things in deeper, just like the cheeks of your mouth, it's going to absorb it in. So I'm a big proponent in like, look at your ingredients in your tampons, ladies. Look at your ingredients in the menstrual cup. Look at the ingredients in the lube. What you put in there if you're going to use, and I'm not trying to bash KY, but their ingredients are not great. So if we're trying to eat better and do our bodies better throughout the whole day, why are we putting crap? Like, it would be like putting chocolate cake in your vagina. I don't know, maybe not chocolate cake. Swiss.
It's like putting Swiss cheese in your vagina.
Swiss cheese. Jeez. But there are great.
This show has ruined cheese for me.
You won't look at it the same anymore. You're going to start going for like the Gouda or something.
It's Gouda.
It's Gouda.
But grabbing something like Silk, it's SYLK, it's wonderful ingredients. Good Clean Love, which is sold at Target, is great, based out of Oregon. And then there's a Yes, Yes, Yes brand that's based out of the UK. But yeah, I give out free samples to that. Slippery Stuff is another one, but like Astroglide, which is typically what patients come in with, it changes the pH balance and the environment down there. So that and KY, like, use something good. Even, okay, this is another problem. Olive oil, people will use oil-based.
Coconut oil.
Yeah. Fabulous. But if your partner's using a condom, it breaks down the condom, and women don't realize that. So then they're like, shit, am I going to get pregnant off of this? Possibly. Yeah. So make sure you're not using oil if you're trying to prevent pregnancy. Use a water-based lube. Okay. And then you don't want, like, glycerin can cause more symptoms down there too.
Olive oil. I've never heard of olive oil.
Olive oil, avocado oil, coconut oil, emu oil, vitamin E oil. I mean, it's all. Yeah. It's not just for cooking.
Up in there. Interesting. Okay. So let's switch over to your workout experience. Okay. Yeah. So you did triathlons. You were a lot of cardio based exercising.
Yes.
And now you're at the gym and we got you lifting really heavy.
Yes.
How's your body reacting? How you're feeling? How's it different between running and strength training?
So I'm still running, not as many miles, but I'm feeling thicker, fuller. Yeah. Compared to
why?
The leaner.
Because you're running off all your muscle. Now you're building it back up.
Okay.
Yeah. So that's going to speed up metabolism.
Yeah. So I wanted like the heavier lifting. My sister's getting married in September, hopefully from COVID. But I wanted to fit into the silly bridesmaid dress. And and now I'm like, shit, am I going to like pop the dress with the way everything's expanding? But yeah, I'm trying to tone up for that.
Yeah.
That's like the very first episode of this podcast. Am I going to get too buff?
Oh yeah, too bulky. Yeah.
Well, I was afraid like tissue's expanding. And I'm like, well, you want definition. Like it doesn't. I don't want it to get as big as my head and not show that there's muscle.
Yeah,
it's silly because I know I like in the PT realm of how the body works. I know how that stuff works, but then like as a female, you've grown up thinking like you've got to be thin and slender because that's what the magazines have all shown, and that was kind of the big 90s. Like suck it in, keep it small, and that's not how life is now or how.
But in the long run, putting on lean body mass, especially for women as we age,
is great. It's great. Yes, because it drops at age of 50, percent down. Yep. So it's smart. I know it's smart. It's just a different feeling.
Yeah, I wanted to
mentally,
touch on this because
it's a mind issue.
Women do struggle with that when they start to put on muscle, but
and the butt, you want it. You talked about people all the time that you need your butt to support the pelvic floor. You've got to have glutes. They're the supportive best friend of the pelvic floor. But then when it starts growing, you're like, shit, it's not fitting in things that it was. It's just a different feeling.
So you got to wear yoga pants all the time.
Yeah.
I don't know what it's like to have a butt.
No. You've been taking those no acetol pills?
No acetol. Since I was born. It like came with it.
No acetol pill. I love using that. It's that and saggy mom butt. Never get old.
Saggy mom butt.
Saggy mom butt.
I mean, that's real. That's true with all of our women. It's and everybody wants, how do I get that back? How do I get my butt back?
Well, and I think big booties are, a lot of genetics too. I know a few girls that just have these big old round booties and, just like calves. I got a few guy clients that have these gorgeous, massive calves.
Yeah.
They don't do any calves at all. They're just born with them.
Wow.
Pisses me off. But
I did learn that about penises yesterday too, in my CEUs. That,
Tell me about it.
Yeah, there's a huge variation between penis sizes, but then
Yeah.
each individual, but even you, like not you, like anybody, like left to right is even a variation. So you have different nerves that supply one side over the other. So it's like really any muscle in your body could be a little bit different left to right, which I found very interesting because we typically think everything to be very symmetrical. And then doing this male CEU course, realizing...
Is that why some people hang to one side or the other? Curvatures. Yeah.
Yep, because you might have a little bit more pull of that Swiss cheese on the one side versus the
Well,
other.
all penises are different. All vaginas are different. You posted that thing on your Instagram with...
the vulvas.
Yeah, the vulvas.
I love the vulvas. Yes. Yeah, different colored vulvas are always welcome. You can tell their natural hair color down there. Everybody grooms them differently. But yeah, it's all welcome.
All welcome
in our place.
Yep. Don't be ashamed of your vagina or your penis.
Nope.
No. Embrace it. Empower it.
Empower your pelvis.
Embrace the cheese.
Embrace the cheese, yeah. Or the bagels. Swiss cheese bagels, that would never be the same. All right, y'all. Well, that's all I have for today. Amanda, you got anything else? Slick Nick? No, we're going to keep coming back at you. We're back in the game. Okay, I was out of the game for a minute, 100 days. Nick, damn, we can't do that no more.
I know. Math sucks.
Yeah.
I'm just throwing that out there.
Yeah. So keep on tuning in. Let us know if you have any topics. We changed the name to Shreducation on iTunes, Spotify, Google Play. So it's now Shreducation instead of just the Shred Podcast, correct?
Some awesome new music.
Oh, yeah, we got a rap song, too. Rap video.
Yeah.
Yeah, you're going to see a rap video. I'm not rapping. Say that for the professionals, but we'll come back at you here probably, next week? We'll do, yeah. We're back in the game. All right, y'all, be safe out there. Meditate, breathe, empower your pelvis, and eat some Swiss cheese. Have a good day.
How'd you like that one?
Time to level up, put in work, getting fit, getting shredded up. Hey, Shreducation, let's go.